It's a fantastic topic area. You can always come back.
Hello everyone and welcome back to another episode of Hello Doctor. At the beginning of the first section, we introduced Dr. Shoaib, a GP and a special interest in ear, nose and throat. We've answered a lot of your questions regarding the ear, nose and throat, and also we looked into Dr. Shoaib's background, why he chose this field and how is he managing in this field and what is some of the advice that he will give to the young people going forward. Let's go back to Dr. Shoaib. Dr. Shoaib, so we mentioned that why we wanted to go into the field of ENT. Could you tell us about one of the most interesting cases that you faced it in ear, nose and throat?
I mean, in cases-wise, there are many interesting. I mean, to be honest with you, I would say ENT is one of my specialties, and I would say to you that for me, general practice is more interesting than ENT, and the reason being is people consider general practice as just a gateway to everything else. But I actually went into general practice after completing ENT because I was actually getting bored with one specialty. So when I first entered medicine, it was more to do with how the human body works. Now, the human body isn't just the ear, nose and throat. It's everything else attached to it. The mind, the emotions and everything else that goes with it. But in ENT, what I found was that there's a lot of things that do go on. And after a little while, it goes quite routine. And you can do the same surgery day in, day out, and one can get bored with that. So depending on your mindset, you can end up getting quite bored and despondent with the specialty. And so I found myself, mind is wandering. I want a bit more. And that's one of the reasons why I chose general practice as a specialty, where I find no 2 days are the same for me.
Very true.
And 1 minute I'm dealing with a patient with a heart problem, another ear, nose and throat problem, another one with a limb problem. I have another interest in musculoskeletal medicine. So I do joint injections, I'm very interested in the way people actually, physical activity linked with their health. And that's something, an area that I promote very strongly within my general practice.
Fantastic.
So this is one of the things that I would say to you that, I mean, cases-wise, if you ask me the couple of cases that really stick out, I can quote you a case from 25 years ago that it was not ENT, but a very fascinating case where a young man came from Malta. I was an endocrine house officer, and every time he went to the toilet, his head would spin when he used to do pass urine. And very fascinating, young, fit, 20-year-old young man. And after all the investigations, he was found to have something very rare, probably one in the whole country, which was something called a pheochromocytoma in the bladder itself.
Wow.
Exactly. So this is, people who don't know about, this is a long medical term, it's a tumor that secretes something called adrenaline. And it's normally found in the adrenal glands. But this happened to somehow end up in his bladder, developmentally. And every time he went for a wee, his bladder will squeeze, the pheochromocytoma, and adrenaline will rush into his blood and cause him, heart will go palpitations, and he will go dizzy and he will collapse. So this was amazing, amazing, I mean, one-off case. I don't think there's been another case like this. So he ended up having surgery, getting that removed, and he was cured. So this is a case that, as always, will stick to me till probably the end of my career that I'll remember.
As a medical professional, I find that super interesting, and I'm sure whoever's in the medical world will also find that interesting, because when you're studying for medical school exams, the thing that we always see, one of the medical questions that always come up is pheochromocytoma. To actually see it, you probably will never have, but Dr. Shoaib has and also has somewhere in the bladder that is completely extraordinary. We have a call on the line. Assalamu alaikum, caller.
Hello, assalamu alaikum.
Wa alaikum salam.
Hi, brother, it's Anwar again. Yeah, I was going to take your address and name, please.
Okay.
So, Anwar bhai, if you, what you need to do is ask your GP to refer you to the Communitas ENT clinic, COMMUNITAS. So this is, if you live in Newham, this is the default referral pathway for you to get into see an ENT specialist now. And you will then, when you are referred and the Communitas clinic contacts you, you can ask them to be put into my clinic if you want to come and see me. Yeah. So you can just remember my name, Dr. Shoaib, or my full name is Ali Ahmed Shoaib. You can ask them to actually put you in my clinic. Yeah.
Ali Ahmed Shoaib.
Yeah.
Okay. And sorry, what's the Did you say community?
Communitas.
Communitas. Don't worry about too much about the name. When you go to your GP, just say, I want to be referred to the local ENT services.
Okay.
Everybody has to go through my clinic or this clinic, basically. Yeah.
And where is the clinic, your one?
The one is actually for Newham is a surgery called Pontoon Dock, which
Newham.
is in E14. Or you can go to Walthamstow. There's 2 clinics.
Fantastic.
Okay, and what's Walthamstow name?
I think
so we can get to these details a bit later. If you leave your number, I can give you the details later on. Yeah, but this has to be through your GP. Yeah, he will be able to guide you further. Yeah.
So Anwar Bhai, I just got a confirmation that the main studio will give you all the contact details for Dr. Shoaib, and hopefully that way the GP can connect you with Dr. Shoaib in that way. Going back to ear, nose and throat, one of the biggest problems probably in the South Asian community, and I know that we've all experienced it from young to old, is reflux, or as we call it, gastric.
Gastric, yeah.
Can you tell us more about what is that and how we can manage it?
So gastric is 2 types. The one that most people know is just pain in the tummy area and indigestion. Now it can remain in the stomach, or it can also go beyond the stomach, which goes into the chest and into the back of the throat. As an ear, nose and throat doctor, I'm more interested in the effects of it in the throat, which it happens. Now, it is very common and I would say almost endemic within the community. And I find that the majority of people who have, so the term that you're looking for is called laryngopharyngeal reflux. LPR is the short we use for, where acid or stomach content, when you go to bed at night, because you're horizontal in your bed, your stomach and your throat is at the same level. So what happens is food or acid comes easily into your throat because it's still in your stomach. Now that gives a pain in the throat, which is sometimes chronic pain. It presents to me. It presents as a lump in the throat. Sometimes difficulty swallowing because it's so inflamed. Now most people don't know why they've got it. So one needs to be investigated. And the investigation starts involving, so for instance, I will look at their lifestyle, how late they're eating. And one of the most important thing in Southeast Asian communities, our Bangladeshi community there, we eat very late, 9, 10 o'clock, 11 o'clock. And we go to bed almost half an hour, 1 hour afterwards. You're meant to eat at least 4 hours before bedtime. Minimum. And if it's fatty food, it needs to be 6 hours before bedtime. Karon better, meat, heavy material like meat or fat, kintu 6 to 8 hours thake. So based on that, you should eat much earlier and change korte hobe. So I would say to you the reality, so that's one. Secondly, the type of food we eat. The thing we need to remember that the acid in the stomach is triggered by certain spices. Now some people get away with it, others don't. Smoking is another one that triggers off acid production. So people who smoke, they will find that there's significant acid problem. Now, one of the things that there's a bacteria called Helicobacter pylori or H. pylori. Everybody who has a gastric problem, if their doctor has never checked for this bacteria, usually is done in the toilet sample, they should ask their doctor to do this test. It's very important. It can cause an ulcer in the stomach or elsewhere, and it can give you significant problems like a bleed in the stomach as well. But generally, what I find is for people in my ENT side of things, people who come with this reflux problem, like some people have problems with their voice because of the acid reflux. So because of that, they end up having hoarseness in the morning. So what I tend to do is treat the underlying problem as much as possible. Heavy weight causes a problem. So you need to lose weight, you need to eat early, you need to stop smoking, you need to have less fatty food in the evening. And then what I tend to do is treat them with, if there's a bacteria there, I will treat with antibiotics. And if there is any problem with regards to, they may get a medicine like omeprazole or lansoprazole, which are known as proton pump inhibitors. And then after that, at night time, I recommend a dose of Gaviscon type liquid. No, it doesn't have to be Gaviscon, but double action. That taken just before bed, without any water to drink afterwards, lines the throat and protects this area from the acid burning. People don't realize the acid in our stomach is so powerful that it can burn a hole through my skin if it fell on my skin.
Yeah.
Only Allah subhanahu wa ta'ala has designed us in a way that it can handle it in our stomach, but not beyond. We don't realize how sensitive this thing is.
And this acid is actually being projected
into the throat. Yeah.
And I'm sure we know that reflux is a risk factor for possibly getting cancer in the future.
That's correct, yeah.
So that's why reflux, we might see it as something, we have reflux or gastric. But really, if you don't control it very well, there is a chance that you can get a certain cancer in the future.
Absolutely. So I think some people put off, they don't like going to the doctors. Some people say, well, another day, it'll come. But that tomorrow never comes, and until quite late in life. And I have quite a few people who ended up with problems, and as you mentioned, cancers of the esophagus, which is the food pipe, or the stomach, because of this chronic reflux problem. But I think generally, if lifestyle is changed, reducing in spice, I enjoy spicy food, but I wouldn't have it every day. Yeah. I wouldn't, and everybody is different. Some people can tolerate more than others. Don't say my next door neighbor has it, therefore I should have it. You see, everybody is different when it comes to life and what their constitution is. It's very difficult.
So I'm going to be off the spicy food. I love spicy food, but guess what? I think just for my my long-term health that I need to get off it. So reflux is a rampant condition around the South Asian community. We see that a lot of lifestyle factors are so important for it, as Dr. Shoaib mentioned, making sure
stress is another one. Stress, significant stress in life will increase acid production. So dealing with stress, very important. As I mentioned, smoking, healthy living, exercising, reducing weight, all of these make a big difference. Even elevating the bed. You know, the bed, normally we think we sleep on 2 pillows, therefore my head is up. No. You need to have a pillow or a bed wedge form that elevates the bed this way, almost like 30 to 40 degree angle, so the acid doesn't come up.
Perfect. So lifestyle factors is such an important thing. 4 hours before, do not eat food. Before you sleep, do not try to eat food, because what you're basically doing is if you eat a large meal and you go straight to bed and you're horizontal, all that food is going to go down, but also going to go back up, and it causes the issues. Also making sure that try to cut down on the spicy food. Smoking, as Dr. Shoaib mentioned, is also something that can increase your chances of reflux, and weight loss is, of course, obesity is another condition that's rampant, and controlling that weight helps all these conditions to be almost reduced or completely going away altogether. And some of the medications that Dr. Shoaib mentioned was lansoprazole and meprazole, which we might be very familiar with. A medication that I know we're all familiar with is Gaviscon. So just take it before sleep and make sure you don't drink any water afterwards, and that should protect the lining.
They can drink water in the middle of the night, it's fine, but just at the beginning.
In the middle of the night is okay, but just before sleeping, make sure you keep it nice and clear so we can protect that lining. So we've spoken about reflux, we've spoken about hay fever, we've spoken about sleep apnea. Let's go back to yourself, Dr. Shoaib. If you didn't go into the field of ear, nose and throat, what field would you have gone into? Let's say not GP as well. What field would you have gone into?
Another specialty. I think I mentioned earlier, I actually enjoy musculoskeletal medicine. So something like sports medicine or orthopedics. I enjoyed that and I think it's quite a logical specialty where you can make a big difference in people's quality of life. In terms of, I deal with a lot of, as I said, MSK, musculoskeletal problems, and a lot of things can be sorted actually even without surgery, and people don't realize that it is about the way they walk. Their weight is again, keep bringing it up because it's a pandemic. Never mind the COVID, the obesity is a pandemic in our society, and it's having huge impact on people. Just as an example, I will mention that I don't know if you may or may not be aware, a 1 kilogram weight loss from your abdomen, from your tummy, reduces 4 kilograms of weight from your knee, 16 kilograms of weight from your ankle. So people who have problems with their knee and their ankle, all they need to lose is a little bit of weight, and it will reduce a lot of the pains that they have in their knee.
That's something very interesting. 1 kg from the tummy, 4 kilos, 16 kilos from there. So you're literally light on your foot, just losing 1 kilo. Obesity, it doesn't matter what speciality you're part of, obesity has an effect in every single speciality, and that's why this show is so important, because we need to promote that good health and make sure that it spreads within all the communities. One thing that I loved seeing recently last year, just before the COVID pandemic, was that there was a marathon that was happening in Sylhet. It was called Sylhet Marathon, and everybody in Sylhet was running around, and I just loved the idea that people were just taking exercise and good health into that measure, and they were propagating that in the community.
Right. So one thing I wanted to just sort of drop here for our listeners and viewers is that I'm from the Bangladeshi community, like your good self. One of the things in our community, women are not actually promoted to do any exercise. So our better half, our other half, 50% of our society, our mothers and our sisters and our wives, the Bangladeshi culture doesn't promote physical activity within the women community, whether it's in Bangladesh or here. And that, as a result, has had a huge problem when it comes to disease burden in that group of people, in the female group. And I see it more so in their 40s, early 40s, late 30s, and as they go into their 50s, and purely lack of physical activity. So one of the things I'm trying to do in my own home is to start promoting physical activity in both sides. Both my son and my daughter, both are active on that front. I would encourage it with my wife and my mother in order to go out. So each person has their capacity, what they can do. They need a bit of encouragement. But it's almost, I say to people, if somebody who prays 5 times a day and you don't miss it, regardless of sunshine, regardless of how hot the weather is outside, regardless of if it's raining or snowing, you won't miss your namaz. If you're going out on a travel, you'll miss prayed there because you know it's important. Why don't you should try and see exercise, physical activity almost in the similar way, like it is something fun to do, because that in itself is at the root of a lot of healthy outcome at the end.
100%. I think it's in Islam, isn't it? To keep yourself healthy, to do your exercise, and make sure that you look after the body that has been granted to you is such an important part.
It's an amana. The body is an amana. We don't own it. We may claim it is ours, but it belongs to Allah subhanahu wa ta'ala. And if we're negligent of it, we'll be asked about it on the Day of Judgment. If we're negligent about our children, we don't own our children either. We are only they are amana to us. So we will have to answer for them as well. If we didn't bring them up appropriately or teach them the right things etiquette. So similar with the body as well.
I think that's one of the beautiful things about medicine is that how you can tie medicine with Islam, and that when you're even seeing a patient and you just do it with intention, like if I make this patient better by the will of Allah subhanahu wa ta'ala, then I am also getting reward for this. And it's such a beautiful profession, and I hope the young people who are watching this understand how important it is to get into this profession and make sure that you can do a lot of good through it. Not get into it just for the wrong reasons. And I'm sure you could tell us more about why we should get into the field.
I think very good point you raise. I think one of the things that are motivating a lot of young people these days is finance, money, which profession will give me the most money. People are attracted going into the city. People want to do businesses and various other things. But what they forget is that happiness, the contentment that they seek through money actually doesn't come through money. It's actually having all the other things in life. So if at the expense, for instance, I had a choice of going into a specialty, would have meant I actually leave my family behind. I had an elderly mother and father I looked after. So I chose a specialty that would allow me to come home to look after them and not go away 100 miles or 200 miles and not see them for a month. And that would have been an issue because they needed me. So because of that choice, I chose my career based on my other needs. So as a result, I have a family that who's still with me. Alhamdulillah, my mother is well and still with me, and I look after her, and she brings a lot of joy to our family and being there. So my children have grown up with their daddy at home as well. So on the basis of that, if I went for a particular specialty and focused that this is going to be the most financially beneficial to me, then I would have just got that, not the other bits. So one of the things I would say to you that, and you're absolutely right. Many patients will tell me, doctor, you're lucky because you're doing a job that all you do is get du'as from us. And I totally agree. And one lady, I gave an injection to her knee just before Hajj. And she remembers me on the plains of Arafat. And in her du'as, she prayed for me. I can't ask more than that. I can't ask more than that as a doctor. So because she was able to walk for the whole of the Hajj without any pain because of what I did for her. So what I find is, I think for the younger generation, what you'll find is, and one thing my father always said to me and taught me, that don't chase money. Money will chase you. You know, and I think importantly is you do that which is important for your family, your community, and what you enjoy doing. So I would say to parents, children who are not inclined, for instance, towards medicine, they shouldn't be forced to do medicine. Because there are many doctors, colleagues you will have come across, Akhil and myself, who are miserable in medicine. They hate this profession. And unfortunately, their dissatisfaction, the fact that they're not happy in medicine as a doctor, comes across in the language they use with their patients.
Yes. Yeah.
So রোগীদের সাথে তাদের দুর্ব্যবহার যেটা হয় is because they're not happy in this profession. They shouldn't be a doctor.
Yeah.
But they, somehow, some reason, they became a doctor because they had to listen to their parents.
Yeah.
So this person would have been better as an accountant or something else. And he would have been much happier. You would have seen a smile on his face. Yeah? Even though he sends you a tax bill. But so, you know, it doesn't. That's the reality. But I would say to you, children should be encouraged in the way that they feel the subject that they actually enjoy.
Yeah, I love that because my father also taught me the same is chase impact, make a difference, chase impact, and the money will come.
Yeah.
It will come through.
That's right.
And we can see it, mashallah, the accolades you have, you're a doctor, you have special interest in ear, nose and throat, you have an LLM, you have a PGC, medical education, like the degrees are piling up, and I think it's because you love the field you're going into. That's and right. You also enjoy Islamic studies and the law behind it. And we hope that through this, and especially young people are watching this, you can be an example for them to say, this is the route that you can take, and this is a route that you can be, inshallah, successful for because you enjoy what you're doing. Is there any final messages?
Yeah, my inspiration actually came from history, because I enjoy studying history, and especially the history of Muslims and Islam. We have a 1400-year history that majority don't know about. And it's a massive history, much longer than American history, much longer than, the British history is not really more than the kings and queens fighting each other. We have an amazing history, and I would strongly encourage people who haven't looked into it, should do. My inspirations comes from something called, the English term called polymath, or some of the classical scholars who were Islamic scholars. They were doctors, they were basically astronomers. They were basically mathematicians as well as surgeons. So the same person had the same 24 hours that I have. My time has not shortened. It's the same 24 hour on the clock, but in their short time in life, they achieved so many things because they actually believed that they can do it. And what they haven't been told, in the old era, Muslims were encouraged to explore and gain knowledge in all fields. What has happened in the current reality today, we are actually boxed into a specialty very early on.
Yeah.
And what we end up doing is we follow a career path, which is, whether we like it or not, we find it difficult to change later on.
Yeah.
So there's misery associated with it, and we don't, and life becomes miserable as a result.
Very wise words to end it with. I know that I've enjoyed learning from you, Dr. Shoaib. I'm sure our audience have as well. Thank you very much for coming in today. Thank you everyone for coming into another episode of Hello Doctor. Inshallah, we'll see you in the next episode. Assalamu alaikum for now.